So maybe one way to start is to just remember that today is World AIDS Day. And the theme for this year's World AIDS Day is End Inequalities, End AIDS. And I mention World AIDS Day because a lot of the struggles around access to medicines that we're fighting now with COVID-19 are the same struggles that we fought during the 1990s for access to antiretrovirals. And there's a similar kind of blockage, which is the unfairness in the world trade system, which I'll speak about in a bit, and particularly intellectual property rights. So as Peter explained, vaccines work to prevent hospitalization and death, and that's why they're so important to ensure that everyone gets access to them. And they also help to prevent mutations of the COVID-19 virus from emerging, and that's another reason why they're so important. And so then we have to ask ourselves, if all of this is true, why don't we have more equitable access to vaccines, and particularly on the African continent? Because you would assume that everyone would feel safer if more people have access to vaccines and there's less potential for variation to emerge. So I want to focus on a couple of reasons for the lack of vaccines, lack of access to vaccines, particularly on the continent. I think it's important to acknowledge that South Africa is a bit of an outlier. So we have a relatively high rate of vaccination, but on the continent, I think we have 41% or so of people at least having one shot. 2 shots, it's in the 20s. But on the African continent in general, there's only about 7% of people that have been vaccinated. So the continent is in a crisis thanks to vaccine apartheid. And one of the key things that's causing this crisis is law, and particularly intellectual property law. So intellectual property laws are known as trade-related aspects of intellectual property rights. This is, in short, it's referred to as TRIPS. It's an intellectual property framework that's enforced by the World Trade Organization, and it allows companies to take patents on their inventions. So basically this means that once they have a patent, they alone can decide who should make their products, how many to make, what they should cost, how many they should sell in particular markets, and also who they should sell to first. And even if these companies get a lot of public money to develop their products, or they use public facilities like labs or universities, or even when they have public employees like government scientists on their teams, they can still take out these patents. And these patents basically allow them to privatize the knowledge that they generate. So to privatize the knowledge, for example, about how to make a COVID-19 vaccine. And they can do that even if they, like I said, use public resources. So government may, for example, give them an amount of money to assist with vaccine development. And it's important to note that that government money is public in the sense that it's tax money. So it's generated through taxation. And we all pay taxes. When we purchase groceries, we pay taxes. When we file our income statements, we pay taxes. So people across all class levels pay taxes. And despite that, the TRIPS framework allows companies to take out patents for a period of 20 years. And it's very tough to challenge those patents. And so what we've seen is that companies have used these patent rights to block anyone else from getting the knowledge that they need to make COVID-19 vaccines or tests, which we need to track where the virus is in the population, or medicines, therapeutics that are needed to manage the pandemic. And patents have even been used to block things like PPE, so something like a N95 mask that would be really effective in blocking vaccine particles from entering the body. All of these technologies are patented. And so this is a key obstacle to managing the pandemic effectively, because it means whatever suppliers are out there that could make these vaccines, diagnostics, PPEs, are blocked from doing so. And that makes the pandemic persist, and it makes it also more likely that viral variants will emerge. So some examples about public money. In the US, there's a company called Moderna that's received almost $2 billion in public support for developing their COVID-19 vaccine. And then on top of that $2 billion, they received about another $8 billion for whereby the US government guaranteed that it would purchase Moderna vaccines should they prove successful, to the value of $8 billion. So let's round that up to $10 billion that they've received in public money. What's ironic is that the same company is refusing to let the US government register as a fellow patent holder for their vaccine. So it means, therefore, that the US government doesn't have the legal right to produce a vaccine that it helped to finance, even though it invested so heavily in it. And therefore, the supply of this Moderna vaccine, that's one of the most effective vaccines, remains limited. And it's an artificial limitation because if other people knew how to produce the vaccine, they could increase supply, and increased supply would presumably mean more people have access to the vaccine, and there's less likelihood for variants to emerge. So again, sticking to the example of Moderna, in South Africa, there's a company called Afrigen, and they're trying to replicate the Moderna vaccine. But the process is really, really slow. And partly that's because Moderna won't help them to replicate the vaccine by sharing the recipe that's needed to make it. So again, even though there's a lab on the African continent that has the capacity to produce a vaccine, they're prevented from doing so, or at least slowed down from doing so by the patent holder. And so the vaccine supply remains artificially limited. And so it's important to note that the argument that there's no capacity on the African continent to produce vaccines, particularly mRNA vaccines, is not true. The MSF Access Campaign has calculated that there are about 7 sites on the African continent that could be used for mRNA production, and that with tech transfer, they could be brought into operation and deliver vaccines within a period of months. So again, we see patents being a blockage, but not only patents, also the inability of even influential governments like the US to put pressure on companies like Moderna to share technology. So there's also a way in which money and power, so not just money, but money and power, the combination, restricts access to vaccines. One of the places in which the Omicron variant has been picked up is Botswana. And Botswana, like other countries on the continent and in the global south, has struggled to get access to vaccines. So one of the things to remember is that at the beginning of the pandemic, we were told that a system would be set up to make sure that there would be a fair distribution of vaccines. And the system was supposed to be administered by an institution called COVAX. And COVAX was supposed to be the single buyer of vaccines. And it was supposed to ensure that health workers everywhere would be the first to receive COVID-19 vaccines. But COVAX failed. And one of the big reasons why it failed was because countries like the USA, like Canada, made deals with vaccine suppliers. They made bilateral deals, and they basically pre-purchased the available vaccine stock for their own populations. And as a result, COVAX was unable to get access to the vaccines. And therefore, by and large, the developing countries that had put their faith in COVAX couldn't get access to the vaccines. So this is one of the key causes of lack of access to vaccines during the early days of the pandemic. So then countries shifted to doing bilateral deals. So in other words, making deals directly with the pharmaceutical companies. And so this is one of the things that Botswana did. And in July this year, they made a deal with Moderna to buy 500,000 doses of vaccines. So what's one of the reasons Botswana could do this? It could do this because there's a big diamond industry. And together with De Beers, Botswana, and DTC Botswana, there was therefore a pool of money that industry contributed along with the government to be able to purchase vaccines. And so in this sense, money does matter, economic might does matter, right? So at least Botswana had some resources to purchase vaccines. But again, there's a limitation of money and that's power. One of the things we see, for example, in the case of Botswana, is that they didn't really have the power to negotiate a very good price for the vaccines. So they purchased vaccines at $29 a unit. And in comparison, for example, the United States paid about $15 to $16.50 in Europe. They paid about $23 to $26 per vaccine. So there is also a kind of limit that countries face. So one limit is, can they purchase vaccines? And that's determined by the amount of vaccine supply, but also whether countries have the economic power to purchase vaccines. Then countries, particularly on the continent, might have limited negotiating power in terms of the price at which they receive vaccines. And one of the limits, of course, that they also face in regards to pricing is that countries are not allowed to disclose to each other what they're being charged for their vaccine purchases. Often the drug companies, the pharma companies ask them to keep this information secret. But one of the big constraints is also in terms of the power of the producer, the patent holder. And so in Botswana, this played out even after having purchased these vaccines, which would only have brought the vaccination rate up to 10% of the population. Botswana was then hit with supply delays. So other countries jumped the queue, got Moderna vaccines before Botswana did, and their supply of vaccine was delayed, and this delayed their vaccination program. So I'm using this example because it illustrates, I think, that power isn't only about money, it's about all of these other constraints that countries face. So I think the key issue to keep in mind is that these supply issues are artificial. They can be changed by suspending intellectual property rights on COVID-19 technologies. But the obstacle to this is that a small group of countries are blocking this from happening. And so especially Germany, Switzerland, and the UK. The European Commission, which is the body negotiating against the TRIPS waiver at the World Trade Organization, is blocking the waiver, even though the European Parliament, which is the popular body that represents the European people, has said that it supports the waiver. So one of the steps we need to increase access to vaccines is to lift the intellectual property rights on vaccines, medicines, therapeutics, and diagnostics in order to increase the number of manufacturers that can make these products and distribute them. But I think it's also to keep in mind, and I'm going to close quickly, hopefully, that at the national level, we also need to keep encouraging people to wear masks, like Peter said, to wash or sanitize their hands, and also to get vaccinated. I think it's important to keep in mind that to wash our hands, we need water. And in many municipalities in South Africa, we're facing water crises. Johannesburg is just the biggest example of this recently. And so in terms of kind of structural features that also drive the pandemic, access to water, to clean water and sufficient water is one of the drivers that we need to think about. We need to boost our vaccination rate. But to do that, we need to invest in our public health system. One of the reasons people mention for being hesitant is that they're not sure they can access care if they have negative side effects. And so this is kind of, I mean, one could look at it as an assessment that people have, that they don't have reliable access to healthcare services when they need it. And this is one of the stressful things to consider when they're trying to think about getting vaccinated. So we need investment in our public health system. One of the things that's obvious is that to fight off any disease, you need a strong immune system. And what we've seen in South Africa is that there are high rates of hunger, high rates of unemployment, high rates of poverty. And so that is a concern. I think, again, a kind of structural concern, a downstream driver of variant emerging, of being vulnerable to the COVID-19, to infection by COVID-19. So South Africa also needs to think about its food system as one of the key components of public health. And then finally, maybe just to mention that, you know, vaccine apartheid isn't something that has a gender neutral impact. This past week, we've seen vaccine apartheid result in the stigmatization of many Southern African countries. Travel bans have been imposed to and from South Africa, amongst others. And of course, one of the things we know is that the tourism sector is one of the big sources of employment, and the service sector more generally. The majority of people in the service sector that are employed in the service sector, especially the low wage part of that sector, are women. And so what we're seeing with the travel ban with the travel bans is a destabilization of women's access to employment. And this is particularly concerning because it's been a 2-year period where that sector has been destabilized. And we saw yesterday that unemployment rates are higher than ever, and that women during the pandemic have been disproportionately affected in terms of job losses. So that's the one part. But the other part about the gendered impact of the pandemic is that most of our health workers in the front lines are women. And so again, if variants emerge that are resistant to the vaccines or can evade some of the protective effects of the vaccines, that means once again that our health workers are put under pressure. And they're put under pressure in terms of risk of exposure, but also the stress and trauma of having to deal with death, but also the stress and trauma of having to think about the risk of exposing their own households to a COVID-19 infection. So intellectual property rights in this way, it's not gender neutral. It is actually something that actually exacerbates the worst inequalities in our society. And so that's one of the reasons why it's so important to address it.